Yes, this is Francine. I'm here to talk about foot care. This is my foot. This is my left foot. Especially when you are diabetic, you have to make sure you do not cut your own toenails. You got to go and see the foot doctor. You have to let the foot doctor cut your nail, because if you do not let the foot doctor cut your nail, you will run into a lot of problem. That's what happened to me. I run into problems where I did refuse to go to the, after knowing that I have diabetic, and the doctor told me that when you getting ready, when your nails is grown out, do not cut it yourself. Go to the foot doctor and have them cut your nails, because people with diabetes should never cut their nail. But I did not listen to the doctor. I cut the nails myself, because I'm thinking I can cut my own nail better than any doctor could cut my nail, my toenail. So that's what I did. I keep cutting the nails all the time till one day I noticed my at the side of one of my nail, the big toe, at the side of my big toe kept hurting, and I continue cutting the nail, but it keep hurting and hurting. So I would go to the store and get some antibiotics and put on the toe, and it get very red. I put antibiotics on the toe get a little bit better, and I continue to cut the nails until one day the toe get very swollen, and I'm still treating this toe, and I didn't think nothing about it, that it was something wrong with the toe, until one day I tried to put my shoes on, and my toe was so painful, and I still didn't go and see a foot doctor. I buy a bigger size shoes, because I was wearing a size 18 and a half, and I buy a size 9, just that to go to the foot doctor, because I thought I could do a better job than the foot doctor. And one day the pain got real bad, and I end up with an ingrown toenail. And what I did, I tried to take care of it myself. I got me a nail file, and I got me look like a box cutter. A box cutter, and I said I'm going to remove the ingrown toenail myself on the side, because the nails grow inwards instead of outward. So I used the nail file, try to pull the nail out of the toe, and when I pull it out of the toe, it's bleeding. So I get a nail clipper, and I clipped the nail off, but it was still sore, but I got that piece out. Then I keep treating it myself with antibiotics, and I would throw what you call it, paras I forget the name of it. Anyway, I was treating the nail. I throw oh gee, not alcohol. This stuff in a brown bottle. I think is para something. I I can't pronounce the word, but I was treating the toe myself. What I'm telling you is, when the doctor tell you to do something, especially if you're diabetic, you got to listen to what the doctor said, because it's for your own good. And I keep treating this toe, and it got better. It was fine. and I figured everything was all right. Then, when the toenails start to grow again, it start growing inwards, and I kept cutting it the way I do. Peroxide, that's the word I was looking for, peroxide. I keep using peroxide, and I use the antibiotics on it, and I would put a band-aid on it, and it would heal. And then when the toes start growing out again, the problem keep happening till one day my feet got the toe got so huge. I have no choice but to go to the doctor. And the foot doctor took a look at my foot and he said, "Why didn't you come to me earlier? You know you're diabetic and the toe is in bad shape." And he said I have to remove the nail. And I said, "Can't you give me some other treatment? Can I get a treatment, some kind of, instead of removing my nail? Because I know I like to wear nail polish and stuff. And when they remove the nail, it's impossible for the nail polish to stay on. I know people who have their nail removed, and you can't wear nail polish on it. It will stay on it for a couple of hours, then you look down, the nail polish disappear. You take a shower and the nail polish is gone. So he said, "You know what? You can't think of vanity. You have to think about your health. And I have to remove the toenails because you don't want gangrene to set in your toe. Then the next thing, we have to remove the whole toe. Then if I remove the whole toe, you're going to be walking with a limp." And so I agree for him to remove the toenail. And he called the nurse in and they set up for me to have my toenail. I was so scared, my toenail to remove. And he gave me around 6 needles. 6 of the biggest needles you've ever seen, because they got to go in the muscle. That needle have to go in the muscle. And he gave me needle around the toe, under the toe, on the side of the toe. And then he let me wait for around 20 minutes. And he come and he checked to see if the toe was numb enough for him to remove the nail, but it wasn't. I was still feeling pain. So he has to go around and give me 6 more injections. I'm telling you, if I did have to pee, I would have peed on myself. I screamed so loud, you could hear me screaming all the way from Florida to China. That's how loud I was screaming. The pain is terrible. And after a while, the toenail, it numbed the foot. And I'm telling you, removing the toenail was not hard. I mean, it was not easy. It was very hard because it took him a long time. Digging, pulling, tucking, doing all kind of stuff to my toe. Then he finally got the toenail out. I mean, that stuff bleeds so badly. It bleeds. You have to put some acid in the raw foot and to stop the bleeding, and put some acid around the toe, inside the toe, so that the nail wouldn't grow back on the sides. Then he wrapped the foot up. Before he wrapped the foot up, he put some medication in it and put medication around it. And he wrapped it very tight and put me on a big boot on my foot and tell me to go straight home. They don't want me go to no store walking around because it could start bleeding. And they don't want that. They want me go home and elevate the foot. And that's what I did. But let me tell you, this foot here, I suffer with this foot. It get infected. I was in pain. I have to rush to the emergency room because of the infection. I mean, the foot looks so disgusting because he told me, don't he want me to take the bandage off it in the days. He said, do not wear no bandage in the day, make it get some hair. I remember one of my girlfriends stopped by to see me, and she looked down at my foot, and you could see her face, like my foot looked disgusting. I tell you, I didn't think this thing would have got better. It takes so long to heal, and it was so painful, very painful. I haven't wore shoes. I think it's probably around 7 months. I couldn't wear shoes. I have to wear this big boot. Shoes on one foot, or flip-flop, or slippers on the other foot, and a big blue boot on the other foot. Then I would go to the store. Now I'm scared that somebody might step on my foot, because if they step on my foot, I know the pain that I'm feeling. I would have fainted. I would have passed out because it was so painful. But what I'm trying to say, what I'm really trying to say, that you got to take care of your feet. You got to take it's better now. I'm having no pain with it. It's healed, but as you could see, I have no toenail in there. I polish it anyway. And someone was telling me a couple weeks ago that I should, or a couple months ago, that I should get some of the Band-Aid. They have some Band-Aid that look like your complexion, and you cut it out and put it on it like toenail, and then you could polish your nail with it. So anyone of their feet, their big toe removed, you could get some Band-Aid that match your complexion, and you could cut it out the same way your nail is shaped and put it on, and then you could put nail polish over it, and it will look like your toenail is there. A person would have to be paying real close attention to your foot. You know, they have to really be staring down. I mean, bend down looking at your foot to know that you don't have a toenail. You just get the Band-Aid, put it in, put it on the toe, cut it out, put it on the toe, and put your favorite nail polish on it, and that works. And you got to always listen to the doctor. If the doctor tell you to do something, especially you have diabetes, please, you got to listen. I come so close to lost my toenail. Not only my toenail, not my toenail, sorry. And I don't edit my videos. If I talk and make a mistake, you're gonna get the real deal. I don't edit nothing. So I mean, you don't want to lose your foot. You got to do what the doctor said, you know. One time I was embarrassed of my toe. I'm not embarrassed of it, because you got people with no toe. You got people with no foot. People which they have toes. So I'm not embarrassed of my toe. Sometimes I go out just, I put on my slippers, and I go out just like that. If I'm going to church, and if I don't feel like polishing that toe, I don't do it. It's my toe. If people don't like it, don't look at my foot. But what I am trying to tell you is, you got to listen to the doctor. Whether about your medication, diabetes is no joke. Diabetes will take you out. The doctor gives you medication, make sure you take all your medication. Make sure you drink plenty of water. And you got to go to the doctor and have a checkup at least every 4 months. They got to take your blood and and send it to the lab to see how the blood is doing, how your A1C, how high is your A1C. Your A1C is very important when you have diabetes. they say diabetes, people with diabetes is to stay away from sugar. But you can't stay away from sugar because when the sugar in your blood drop low, you got to eat something sweet to get it back up. So how can you stay away from sweets? People with diabetes have to have sweet in their house. They have to have something sweet, whether it's glucose pills or hard candy. You have to carry hard candy in your pocketbook at all time. You got to carry glucose pills with you all time. Eat one or the other, but it's best to carry the glucose pill because it goes to your bloodstream fast. Or it's good to drink for lunch. It's good to have your glucernia. That is very good too. It regulates your blood sugar. You don't want your blood sugar to be high, and you don't want it to be very low either, because you have to always monitor your sugar. You know, I wear a Dexcom G7 on my arm. You know, it's help, and I have a receiver. The receiver tell me how high is my blood sugar or how low is it. If I'm sleeping and my blood sugar drop too low, it's like an Amber Alert. It makes so much noise. It wakes you up. It wakes you up real fast, you know, so you could go take care of yourself. It's alerting you that your blood sugar is too high or too low, so you know what to do. When the blood sugar is too high, you could boil 2 eggs. Boil yourself 2 eggs when the blood sugar is too high, and eat it. That will help lower your blood sugar. Or drink water. Drink 2 bottles, any bottle. Drink 2 bottles, 16-ounce bottle of water. That can lower your blood sugar. And another thing can lower your blood sugar if you have some peanut butter. You eat peanut butter, that can lower your blood sugar. You can have it with some white crackers, unsalted crackers, that make it lower it slowly. You don't want to get a big drop, because if you get a big drop, that's no good, you know. One day before I have the Dexcom G7, I went to the store, and I just got out from my doctor's office, and she was having me doing some exercise in there. Then I stopped at 2 stores. One store was a clothing store, the next store was a food store. Well, I just finished picking up some grocery, and I got out the store and I stand up. I was waiting for someone to pick me up. I have the cart. All of a sudden, I feel very weak. I didn't get my Dexcom G7 yet, so I didn't know that my sugar was getting low, or it was high. I didn't know whether it was high or low. So what I did, I have some ripe banana. I started to eat one of the banana real fast. I was so nervous the banana dropped out of my hand, so I peeled another one and tried to eat it. I was getting weaker and weaker, so what I did, I pushed the cart back into the store where I know that I would get help, because the store was full of people and it's a food store. I got into the store and I started screaming for somebody to help me. I was screaming for help because I couldn't stand up no more. I was so weak. I was leaning on the cart. I couldn't stand. I was getting so weak. The place started looking white. All I see was white. I couldn't see people no more. My sight got white. Everything was white. So I'm screaming for somebody to help me. I said, can somebody please help me? I am diabetic and I believe my blood sugar is dropping. Can somebody get me some orange juice, please? And I keep screaming, can somebody get me some orange juice? And this lady, she and her son went and get me some orange juice, but it was like a split second, but to me it was like 10 hours, like they take a long time, but they didn't. They were moving as fast as they can. And when I got the orange juice, they give me the orange juice. I couldn't hold the orange juice. My limbs, I couldn't hold nothing in my hand. She gave me the orange juice. I was about to drop the orange juice because my finger couldn't grip the orange juice. And the lady opened the orange juice and shake it up, and she started to feed me with it. And I'm holding on to the cart, and I said, could somebody get me a chair, please? I can't stand no more. Someone get me a chair. So they got me a chair, and this lady, this stranger, and her son feed me the orange juice. They feed me the orange juice, and the orange juice was rolling back out of my mouth. I couldn't swallow. They were saying, take in as much as you can and swallow it. Take a big gulp and swallow it. I tried. And the orange juice kept rolling out of my mouth, but I was drinking. They tell me to hold my head back, and they was throwing the orange juice down my throat. And that happened probably for around 20 minutes, but it seems like forever. And all of a sudden, everything started coming back. My vision started getting clear. I could see who was helping me because the whole place was white. And this lady here, I was telling her thanks so much. I get my strength. I could stand up. Before I couldn't even stand up, And she took my phone and she said, is anybody you want to call? And I tell her. And she called my girlfriend, and my girlfriend come and pick me up, So my girlfriend said, you want to go to the hospital? But before I leave the store, I tell everyone, thank you very much. I appreciate you helping me. Thanks. Thank you so much. And and I'm so happy that this happened into a food store. Because if I was in the clothing store when this happened, I don't even think I would make it for the ambulance to come. And my girlfriend, she said, you want to go to the hospital? I said, no. I said, take me to McDonald's. I'm hungry. That's why this happened. I'm hungry. And I went there and I eat, and my body felt as if nothing was wrong with me. Not a thing. And I went to see my doctor. My doctor said I was slipping into a coma. That would happen to me. I was slipping into a diabetic coma. And if someone wasn't there to help me, I would have been in a coma. So, people, diabetes is nothing to play with. If you can, get the Dexcom G7. Get the Dexcom G7. That is very good. It can help you. The Dexcom G7. And you should listen to what your doctor said to you. Always listen to your doctor, because they know better. And diabetes, when your blood sugar is too high, it could put you into a coma too. A friend of mine, like 4 months ago, his blood sugar went up to 800. He slipped into a coma. And he never come out of the coma. He passed away. So it is the diabetes. It's not no joke. It's no joke. It's no joke. So you got to take care of yourself. You got to take very good care of yourself, because you have to take good care of yourself and listen to your doctor. Look in the drawers. You see my Dexcom G7 in the room. The drawer. In the drawer. Yeah. I'm about to show you the Dexcom G7. No, this is my foot. The drawer.
The
Second one. God. Okay. Yeah, I'm waiting to show you something. The top drawer, the second one, the top drawer. Yeah. That's okay. Could you all what? This is what you got to get. This is what you got to get. You ask your doctor to get it. This is what can save your life. The Dexcon G7. This can save your life. I hope you can see what I'm showing you. Dexcon G7. People with diabetes, please ask your doctor about the Dexcon G7. This is a lifesaver. Try and get it. It's very good. It can help you, can save your life. This is Francine Williams signing off. Have a blessed day. Thank you. Please subscribe to my channel and like my channel and share this information. Thank you.